Dr. Susan Spillman here. I'm a psychologist and a Fast Track for Kids practitioner and trainer. And I'd like to chat with you briefly about my experiences with Fast Track for Kids. I have seen kids for the last year very intensively. I've been really interested in many different children, different ethnic groups, socioeconomic groups, all of that kind of stuff. And this is what I've seen. I've seen basically what I consider three different groups of kids. So one are the group where they're having adjustment problems. So they're having a conflict at school with their friends, some kind of minor problem with their siblings, that kind of thing. And these kids often can resolve their issues very quickly, and they engage very easily and very quickly with the cards. And they can release whatever's bothering them, feel much better, kind of get on with their life. It's fairly simple, straightforward, and very easy. Okay? Then we have the kids who are angry. And of course, there are many angry children. I've seen mostly boys, although of course there are girls as well who are angry. And these kids engage with the cards. They, of course, love the angry card. They usually jump immediately to the angry card and the frustrated card. And sometimes they'll move on to the sad card if it's a little bit more complex session. And they will release some of their anger. But my experience is that mostly they're not really ready to release all of the anger. And when I've explored this, it turns out that, of course, the situation is quite complex. It's not just a matter of them releasing their anger. It has to do with the family dynamics often and their situation. And so what I found is that engaging the parents and talking with the parents about this, sometimes doing some education with the parents of how to listen to the child. Because so often I've found that what the parents are concerned with is stopping the anger. You know, I just want the anger to stop. And what's really helpful most of the time is to help the parent learn how to listen to the child. What is it you're angry about? What is it that we can do about this? So that we work on the whole relationship of the parent and the child. And this has been really very helpful to the parent and the child, and has allowed the child then to release a lot more anger once they feel like they're listened to. So I've had quite a few experiences with this, of this same kind of pattern with the angry kids. And then we have the kids who are traumatized. And these kids are, in some ways, a different group, in that trust, of course, is a big issue with these kids. And so often we need multiple sessions with these children to work on the trust issue for them to, they know often that they've had a painful experience, but they often aren't really ready to release all of this painful experience. And sometimes this is because they're very engaged with the person who traumatized them, and they feel that if they give up that trauma, those feelings about that, whether they're angry, sad, hurt, anything like that, that this will destroy the relationship with that person. And so, you know, it can be quite complex, this issue with trauma. And so we need to work on that with them, with those kids, and just to help them engage with the process, help the parents engage with them about what happened in the time that the child needs, not to rush the child. So these are some thoughts and experiences I've had over the last year, and I hope they're helpful. Okay, thanks. Bye.